Today's workshop is Introduction to Vermont Developmental Disabilities Services. I'm excited to introduce you to Melanie Feddersen, who is the Developmental Disabilities Services Specialist Supervisor at the Department of Disabilities, Aging, and Independent Living. Thank you so much for joining us today. Melanie, I'll turn it over to you.
Thank you. I'm going to share my screen. So my name is Melanie Feddersen. I've been working at the Developmental Disabilities Service Division for about 8 years now. And prior to that, I was providing direct service to folks at a local designated agency. So there's a lot of information that I'm going to be going over today. And I have just a handful of goals. And I want to make sure that people understand the eligibility criteria for Medicaid funded developmental services in Vermont, the type of services that are available with this funding, the role of the designated agencies and how to locate them within your county. And also I have information embedded on the slide of certain topics of where that information lives in the in certain policies or manuals and the pages it can be found on. So if people want to go and get more details on the information, they can. So the Developmental Disabilities Division is a division within the Department of Aging and Independent Living, and we are all part of the Agency of Human Services in Vermont. We provide Medicaid funding. We designate agencies to provide developmental services using Medicaid funding. We provide technical guidance to agencies to help them understand state and federal rules and policies when providing these services. We have a quality assurance team that completes quality and designation reviews for 15 developmental disability services agencies in Vermont. And we also provide or approve the funding to these agencies to provide these services. So there are 15 service providers within Vermont. There are 10 designated agencies, and those are agencies that are required to provide or coordinate services to people living within the county that they are assigned to. They provide regional crisis response, and they also complete the initial intakes for people new to services. And through that process, they confirm financial eligibility, clinical eligibility, and also that the person meets the specific funding requirements for each of the funding programs within Developmental Disabilities Division. There are 10 of these agencies across the 13 counties. There are additionally to those agencies, there's 5 specialized service agencies. They are not assigned to any specific county. They can agree to provide services to people if they believe they can meet that person's needs. They tend to be smaller, about I think the average is about 100 people they serve per agencies. And again, they're located in various parts of Vermont. So when somebody decides or their family decides that developmental services would be helpful, the process is to contact the designated agency within the county. And there is a link on the slide for people to find out who is assigned to their specific county. So the designated agency is expected to complete the required assessments or coordinate them, explain how long the intake process will take, and when the person and their family will be notified of the eligibility determination, and also explain if the person is found eligible, the potential supports that may be available and the potential support providers that they can choose from. They're also expected to explain eligibility appeal rights, and the process is expected to take around 45 days from when the person applies for services. So eligibility. So there are 3 essential gates, I like to call them, to be eligible to receive developmental services in Vermont. So the first piece is financial eligibility. So the person must have been approved for Vermont Medicaid to be able to receive services through one of these agencies. Once that piece is in place, then the agency will confirm they meet clinical eligibility. And what that means is somebody has an intellectual disability, which is an IQ of 75 or below, or has been found to meet autism spectrum disorder criteria. In addition to either or both of those diagnoses, the person also is required to have significant deficits in adaptive functioning. So these pieces or criteria must be present prior to the age of 18 to be eligible for services. But that doesn't mean that the assessments have had to be completed prior to the age of 18. We're finding that there are folks, coming to services that for whatever reason, didn't want or need services until later in adulthood. So in those situations, what happens is when the psychologists are completing the necessary assessments to meet clinical eligibility, they are going to determine that it's their clinical opinion that the pieces that they're measuring or finding were present prior to the age of 18. And they do that by confirming there were no events past the age of 18 that may have affected someone's cognitive abilities. Let's say there wasn't a traumatic brain injury, there wasn't substance use or any other potential event that could have affected what's being measured at a later age. After those two pieces are, if they person continues to meet eligibility criteria, then they look at the funding eligibility for the specific supports that may meet that person's needs, and we'll go over that more in future slides. So the question that comes up a lot is when should the assessments be done? And they can be time consuming and take some time. So they're needed when the person actually applies for services. So if there's and the certain tools have been created to work with certain age populations. So a young child, should be assessed prior to the age of 5. A school age child would be between 6 and 16. And adults would, the assessments need to be done around the age of 18 with adult tools. And this can be done usually around 16 or older. So again, just to make sure it's clear. So if somebody comes into services as a young child, they would be expected to be reassessed at each one of these timeframes to continue to confirm they meet clinical eligibility. But if an adult comes into services at age 20, they would not need to have been assessed as a young child or school age child. Is about where they are now. The adaptive skills assessments that are needed are considered current as long as they're done within 3 years of the time the person applies for services. So a big topic that, or not even currently, but it's something that tends to come up around this time of the year. When somebody graduates or leaves high school, it's a big time. It's a major event for everybody's life, and especially for folks with developmental services or developmental disabilities that may need services as an adult. So I really want to make sure that any potential stresses can be decreased and to remove any potential surprises. So one thing that comes up is, the assessments that are needed for developmental services in adult are different, or they can be different than the assessments used in schools to meet criteria to receive in-school supports. So making sure to reach out to your designated agency, around the age of 16 or so, to make sure you have the correct assessments. Do they need to be up to date? Should you, be referred to a psychologist to start that process? So again, when the time comes that they're graduating or transitioning from high school, those pieces are in place, and hopefully it won't be as stressful. The other piece I want to make sure that folks are aware of, so unlike school supports that are right, deemed by the federal government, the supports provided to adults are specific to those people and their specific situations, and they're based on any unmet needs they have. So depending on what their needs are, will determine how much supports they may or may not be approved for. So with trying to figure out what an unmet need is, after the financial eligibility is completed, the clinical eligibility has been determined, the next step would be to do a needs assessment. So there are specific categories or life categories that the agency will sit down to review, including communication, self-care, independent living, work, respite, parenting, medical support needs, sleep habits, mental health needs, and clinical support needs. And what they do is look to see what supports are available or currently in place to meet that person's needs, and then compare it to what supports would be needed to then meet their needs to help them live the happy, healthy life that they want to live. So once that is complete, they are required to explore any other potential resource that would be able to meet those needs. And the reason that that's expected is because there is a limited amount of funding that is available for developmental services. And the goal is to help make sure that the Vermonters most in need, have access to those services or funding. So if somebody has an unmet need around employment, they're going to talk about hireability. If there's any, medical support needs, they're going to, potentially talk about the Department of Health and their programs. Maybe there's private insurance that's available through somebody's parent that is also available to cover some of the unmet needs, and also natural supports. If somebody has friends or family that can help out to help meet their needs, then that would be expected to also be explored. So if there's still any unmet needs after the process of talking about what they are and how to potentially meet them, those needs the agency will then, look at the potential services or funding programs to see if those needs meet the funding criteria for each program. So I have a few stops for questions because we are talking about a good amount of information. So I want to just give time to see if anyone has any questions about that information. As we go through, I'll be talking about the specific funding programs and other information that goes into the intake process and initiating services.
Hi, my name is Tracy. I do have a question. I was curious about the intellectual disability part. Like, what if someone has a developmental disability like cerebral palsy, but they have a high IQ? Does that mean that they're not eligible for the developmental disability services?
With just the information you told me, yes, they would not be eligible. But potentially other programs would be available, like Choices for Care, or maybe there's other resources through the Department of Health that the agency could help explore to potentially meet their needs.
Okay, thank you.
And there were some questions submitted earlier that I'm going to try to answer as we go through. And somebody did ask, if somebody lives in another, is graduating high school and wants to move to another county, how does that affect their designated agency? So the designated agency, again, is the county that the person lives in. If they are looking to move to another county, then they should reach out to that designated agency that covers that county, and to talk about when that process or the transfer process, how does it work? What information do they need? The current agency supporting that person is going to need releases signed so they can send over the records, and then depending on when the person actually moves, it could affect when services would start. But I would very much encourage that once that decision has been made, to reach out to that agency. And again, the designated agency is determined about where the person lives. So if they move, then that agency then becomes their designated agency and is required to coordinate or provide services. So some of the funding programs, and again, I don't cover. Oops.
Sorry, Melanie. I see Anne's hand. Do you want to ask your question, Anne, before you move on, Melanie?
Sure.
And you'll have to unmute yourself. There's maybe on the bottom of your screen a little microphone symbol.
Okay, thank you. My daughter is living right now in Virginia, going through a divorce, and wants to move to Vermont to be closer to us, the grandparents. She has she has twin boys, one who is no verbal. They're both autistic. One is nonverbal and one is adorable and communicative. She wants to know, I'm trying to figure out, if she moves up here, right now she has Medicaid in Virginia. If she moves up here, where should she go to live that the schools would be supportive of her twins?
That's a wonderful question. I'm not sure if I can answer that. So part of the specialist team that I supervise, there is a children's specialist that covers the entire state. There's also a public safety specialist and 2 adult specialists. She may have contacts or may know the information to provide to your daughter to potentially explore where to live. if she knows what county she wants to live in, if she's going to live close to you, she could also reach out to the designated agency, which I highly recommend to start the process of what do they need for assessments, because different states have different eligibility criteria for services. So to connect with them as soon as possible, share any records if she thinks that her sons are going to, need or want developmental services, but they may be a good resource and at least point her in the right direction for the folks that have that information.
So whatever county she's thinking of coming to reach out to them, who is them?
The designated agency.
Okay. How would I know what the designated agency is?
Good question. So in the PowerPoint that is going to be sent to everybody, there is going to be a link so folks can click on that, find their designated agency, and then go to their websites to get their information.
Okay. Thank you very much.
You're welcome.
Could I also add, your daughter is welcome to call Vermont Family Network, and we would be happy to help her navigate any sort of transitions and find those resources. And, we could be a good first stop for her. Maybe connect her with another parent if she wants to talk with another parent about schools, that kind of thing.
And what is that phone number? Or it's just you guys?
Yeah, it's Vermont Family Network. We put this on.
Okay. All right.
Yep.
Okay. Got it. Just connect with them. Okay. Thank you very much.
Yeah, we're on the web. Yeah, we're using
Okay.
Yeah.
Thank you.
Okay.
We are seeing a trend right now of folks coming from other states, because Vermont's so amazing, to come to live in Vermont and to, look for services. The challenge and frustration that people experience is Vermont Medicaid can't turn on until their feet are on our soil. And so there may be a gap depending on her son's needs of when services are actually able to begin because of that piece. So, but that is another great reason to reach out to, economic services to start that process. And again, the designated agencies, just to get as far as possible until she gets here. So I have some funding programs that I wanted to also review and talk about. They're not a complete list of all the funding programs, but more information can be found in our system of care on the pages 23 to 48. So after the person is found financially eligible, clinically eligible, and a needs assessment has been done that identifies supports that meet, related unmet needs related to their developmental disability, the agency that will then review different support programs or options that may meet their needs. If the, service coordination is needed, the Bridge program is for children and adults under the age of 22. Targeted case management is service coordination for folks that are 18 and older. There's also family managed respite, which is up to $6,000 annually. So again, that's the maximum. It really depends on the person's needs. That full amount may not be needed. For people who, live in their family's home, that they're under 21 and live in their family's home, flexible family funding is also available up to $1,000 annually. And that is based on the household's income and is not necessarily for services, but that can be used to help the household financially to support the person in their home. Another program that I want to talk about was one-time funding. So at the discretion of the agency providing supports, up to $5,000 annually can be approved as long as it meets one of the allowable uses that's listed in our system of care. It could be to address personal health and safety support needs, a short-term increase in support to resolve or prevent a crisis, assistive technology, adaptive equipment, supports that may not meet a home and community-based funding priority or another funding priority, but are proactive and short-term, small grants that help people become more dependent, different trainings and conferences. And what was newly added to this system of care because of the setting rule that Medicaid has, if somebody has, there's an expectation that everybody has privacy and ability to have access to their rooms and lock their bedroom door. So if somebody, a traditional doorknob doesn't work or a lock doesn't work, that there's additional funds that can be available for folks that are already in services to be able to install maybe a more technology advanced locking mechanism. So that was newly added this year. The support program that is for folks with the most intensive needs is called Home and Community-Based Services. It's also called the waiver program. It is when there's a mixture of services or supports that are available. At least 2 are needed to meet that person's needs. And the services are service coordination, community supports, employment supports, respite, clinical supports, supportive supports, crisis, home supports, and transportation. I'm going to get into what those supports mean and what's available through those supports in later slides, but it would be like a mixture of those supports. And I kind of envision it like a giant buffet of every possible support that is available in those categories. And the agency and the person and their family would be looking to see, what their unmet need is and what could actually be used to meet that need in the most creative way possible. Again, the amount of supports and the type of support would be dependent on the person's needs assessment. And that, the needs assessment again identifies an unmet need, and these supports are needed to meet that need. And also that these needs meet a home and community-based funding priority that I'm going to get into the next slide. So once those pieces have been worked through, the agency providing the supports would create a funding proposal. And it's just information about the person's unmet needs, any other information that would be helpful to explain why these supports are needed. And it's presented to the division, and then the final determination is made about what supports have been approved or funding has been approved to provide these supports. So there are specific funding priorities in order to receive home and community-based funding. The most common one is health and safety. So that is when there is an imminent risk, the person's personal health and safety. And imminent risk means that there's a crisis that is going to endanger the person or injure them or harm them within 45 days. That can be frustrating because it is very immediate and, the current situation. So there are times when people are frustrated because it doesn't allow for future planning of like when, my son or daughter is ready to move out in a year, because that's not an immediate need. But again, doesn't mean that those, that planning can't be talked about within, with the support team. It's just they can't come and ask for funding until the need's immediate. There's also public safety funding, and that's for folks who pose a risk to public safety or from endangering others, preventing institutionalizations at nursing homes and psychiatric hospitals, employment for transition-age youth and adults. And this funding priority can be frustrating at times because it's part of the criteria is that the person has to have exited high school and that they're between the ages of 18 and 26. The last funding priority is parenting, and that is for folks with developmental disabilities that have a child under 18 in their home, and they're looking for support to help develop parenting skills. Any questions?
Melanie, hi Melanie, it's Diane Bugby
Hi,
calling,
Diane.
or not calling, I'm already here. Sorry. I have a question and or maybe just sort of a request. Could you talk a little bit more about the funding priorities and what that means? Because children can receive home and community-based services, and sometimes there's not a wide understanding of what that funding priority means. Thank you.
I appreciate you bringing that up. So part of the expectation is that there's not a duplication of services. And again, that all other support resources have been explored. And Diane's absolutely right. I mean, a lot of these, or the majority of these supports are for folks 18 and older. And that's because there's the expectation that, school is providing some of these supports. Parents or guardians are providing some of these supports within their roles. But again, that doesn't mean that these supports are unavailable. It's just, those are the questions that we're going to be asking. If there is an unmet need over and above what's available to someone under the age of 18, then the home and community-based waiver is available, and the agency will just need to come to, again, do the proposal to ask for those support needs. We will ask about school supports, children's personal care services, like any other resources that are available to children specifically because of their developmental needs, just to make sure those have been explored. I'm not
There's
sure if that fully answers your question, Diane.
Yeah, I guess I was sort of looking at it from the perspective is that sometimes people think that these services are not available to children under the age of 18, and they actually are. And there are two thresholds to meet,
Mhm.
but this level of service is available to children, and they don't have to wait till the age of 18 if their needs and challenges are complex. So thank you.
There is a question in the chat, Melanie. What is ICF/DD?
So that is a licensing level setting. It's like nursing homes or group homes. There's certain levels of settings that the Department of Licensing has, and that will dictate the supports that can be provided in each setting. There's going to be certain levels of nursing or other supports that are required to kind of be under that umbrella. So an ICF, and I'm going to forget the it's intermediate care facility, I believe is what it stands for. Those are settings that are specific to people with developmental disabilities. There was an ICF in Rutland County up until 2020, right before the pandemic hit, that served 6 people. It ended up closing down, but every state is expected to provide that level of support, whether there is a resource within Vermont or not. So again, it's specific to people with developmental disabilities. The challenge with that setting is states are able to define what that setting means, and how large it is, and what kind of supports that are provided in each setting. So if somebody is interested in that level of support and meets that level of need, we are trying, one of our goals in our current system of care is to develop that resource within Vermont again. So if somebody did want that level of support and wanted to go to another state, we would want to make sure that it falls in line with Vermont philosophies, and it's about the individual person. It's not an institution that that would take away any of the person's rights or freedoms that they would be able to enjoy as any adults would in Vermont.
We have another question in the chat. Is HCBS funding only available to folks that qualify for DDS, or are those funds available for folks in other programs like Choices for Care, where money follows the person too?
Great question. So Choices for Care has another waiver program. They have, it's considered like a parallel Medicaid program to DDSD's HCBS funding. It's similar, but different. So they are, and I'm not an expert in Choices for Care, but they tailor their services for people with high medical support needs and older folks. So there are some supports they do not provide, like employment or community. And there's some supports that they provide that we don't, because our supports are intended to be community-based and not really treating a condition, but just supporting somebody through their life. So again, they're similar but different. One of the differences is with our designated agencies that are required to provide or coordinate services from their county. That is not the case with Choices for Care services. Each agency can just choose to provide the services that, and again, they could be exactly the same services under our waiver, or they could be a little different, but there's no agency designated to provide those supports. Any other questions? I guess the other thing I wanted to add, so there are folks that are eligible for Choices for Care and DDSD HCBS waiver supports. And the expectation is that the information would be provided to the family and the person about the differences, the pros and cons of each program, and then they would choose what best fits their life to for their life goals and to live a happy, healthy life.
I'll just read a comment. Parents can be paid caregivers in choices for care, at least in flex choices.
And again, I'm not an expert, but I believe that's correct. Which again is one of the pros and cons of different programs, and it's about figuring out what best meets the person or the family's needs overall, and then making that choice.
Hi, this is Casey again. Sorry, I just have one last question. I just feel like I have some clients that are in a gray area. I'm working with someone that has cerebral palsy that's nonverbal, significant physical disabilities. He would need 24-hour care, I guess, like someone needs to be around. He communicates using a communication device, but he's very smart. I'm just having a hard time seeing how he wouldn't qualify for developmental services.
And that's not a surprising feedback. I mean, there are folks that would benefit from services, whether it's developmental services or choices for care or other supports that are available in Vermont, but they're required to meet our criteria. So if he doesn't have an IQ of 75 or below, or diagnosed with autism spectrum disorder, then he wouldn't be eligible, which is extremely frustrating if supports would be helpful to him or his family.
Okay, and that's a state I just saw someone say state definition versus federal definition, because I was reading the federal CDC definition of a developmental disability, and it's like a significant disability that impacts your daily life before the age of 18. But Vermont specifically adds on the intellectual disability and the autism spectrum disorder. That might be different in other states.
Other states do have different criteria, eligibility criteria.
Okay.
And I want to look at the CDC, but I believe that is correct. So not everybody with a developmental disability would meet eligibility criteria. Not everybody with a developmental disability would want developmental services, or they may not have an unmet need that these services would be to be approved for services. So again, that is one of the reasons why we really ask people to explore all the potential resources, because we know there's need out there, and we want to make sure the folks with the highest needs have these supports available.
Okay, so it's mostly supports for folks that have intellectual disability. There doesn't necessarily need to be a physical disability, but there could be.
There could be, yes.
Okay, thank you.
So the service definitions for the available services under the HCBS waiver, and I wanted to make sure to share this information because the agencies providing services, they're required to make sure that any supports they provide fall within these definitions. So they're not allowed to provide any services that may be, helpful to the family or person if they request something that doesn't fall within these definitions. So just want to make sure that folks know that sometimes there are limits to what the agencies can do. So service planning coordination is assistance with planning and developing, choosing, gaining access to, needed services supports for the specific individual. Community supports are to help folks develop skills and social connections. Employment supports are provided to assist transition age youth and adults in establishing and achieving work career goals. Respite are alternative caregiving arrangements for paid or natural caregivers at the home that the person is being supported in, and this can be provided hourly or it could be provided daily. The clinical services are assessments that are needed for clinical needs, therapies or group, family, or individual therapies, medication services. They're medically necessary services that there may be a requirement of a certain licensure of like a therapist or psychiatrist or nurse to provide the supports, and that these supports cannot be accessed through the Medicaid state plan. Crisis services are time-limited intensive supports to prevent or support somebody that is experiencing a crisis. They could be assessments, it could be referral to the state crisis beds, it could be local crisis beds. It could be individual. It really depends again about the person's specific needs. Home supports. There are certain different categories of what home supports are. And again, it's about the person's needs. And again, the hope is that these are provided in the most creative, flexible way possible. So home supports are 24 hours a day, 7 days a week, up to that amount, depending on the person's specific needs. Supervised living is hourly or intermittent supports that are provided to in the person's home where they live. It could be their own apartment, a family's home, and the supports are provided, as needed to meet the person's needs. Staff living is a home setting with 1 or 2 people. It's staffed full time, where there's always somebody there 24/7 to meet their needs. Group living, those are licensed home settings that are licensed by the Department of Licensing and Protection. Developmental services has group homes that are from 3 to 6 people, and those are also fully staffed 24/7. Shared living providers, those are settings where somebody agrees to provide support to somebody within their home, and the person in services, moves in with them, and they can be up to 1 to 2 people maximum to receive support in that person's home. The reason why it's limited is 2, because once it hits 3 people, then the Department of Licensing, they're required to be a licensed group home. Transportation services, that's funding for the acquisition and maintenance of an accessible transportation vehicle. And supportive services, those are therapeutically or medically appropriate services that don't necessarily require a license. Those could be therapeutic horseback riding, water therapy, art therapy, just different therapies that could be beneficial to the person, but don't necessarily have a license attached to the person providing that services. And again, it's not covered by the Vermont state plan. So when the agency develops a funding proposal and requests new services, they also have other limitations that they are required to follow. So if somebody is found to have a need related to employment or employment or community supports, the agency is limited to only requesting supports for folks who have exited high school that are 18 and older, and also they are limited to asking for a maximum of 25 hours a week for new services. Psychiatry also has limitations of a maximum of 12 visits per year if the person is not stable on medications, or up to 4 visits per year for folks who are stable on their medications. The therapy or the clinical supports that are available, there is a maximum amount of visits per therapy. So for individual, group, or family therapy, there's a limit of 48 visits annually and a maximum of 96 visits annually in any combination of these therapies that the agency can request for the person. I do want to point out though, so those 3 categories that I just spoke about, that doesn't mean that the person is unable to get more than those services. That is just the maximum that the agency can ask for new services. There could be internal reallocations or other funding available internally in an agency to then meet that person's needs. They just cannot ask the division for more than those amounts. Transportation is different. So there is a maximum amount of $6,999 annually per person for a vehicle. And that is that's not flexible at all. Agencies cannot add additional funding to that maximum. And again, I share this because I just want to make sure, folks know that, agencies are required and bound by the rules that we have and the limitations that the state has set for services. Another piece of information I wanted to make sure folks are aware of. So again, if it makes sense for the family or for the person, if somebody is receiving 2 different funding programs, for example, children's personal care from the Department of Health is available for, I believe, children under the age of 22, if they meet certain criteria. So if the family or person has that funding available, and they also are requesting developmental services, if it makes sense for that person to have it all under the home and community-based waiver, because it's just easier to do. There's pros and cons to doing this, but they have that choice to do that. So it's for folks with, complex and intensive medical support needs or behavioral support needs, and also a developmental disability. And again, there is benefits to doing this but it is 100% up to the family or person if this makes sense for them. High-tech home care is also a funding stream that can be blended with developmental services. There was another question that came in after I created the PowerPoint about dental supports or dental care available to developmental disabilities. So in the system of care, there is a developmental disability services fund that has a maximum of $1,000 per person for dental needs. But I wanted to make sure people knew that there was also programs available through economic services that can help cover dental needs. So that would be a resource that would be expected to be explored to make sure there isn't any programs available or private insurance to cover those needs. And there's also local community foundations that may be available to help cover the dental needs. So wanted to just share that information also, that there is funding available. It's the same expectations that, you know, everything else would be explored also are still there. And that is all the information I have to present. Also, the last slide is the links of the different documents that I shared and we talked about, just so folks can actually go to those documents and the pages that the information lives in to, you know, get additional information. There's also more information within these documents that folks may be interested in.
Thank you, Melanie. Just a quick clarification, Children's Personal Care Services is under age 21.
Okay, thank you.
And so I guess what questions are there? I'll keep an eye on the chat if any come in there.
And I will stop sharing my screen unless anybody would like to. Oops, that's not the one. Okay.
Hi, this is Tracy again. I accidentally sent this to the wrong person in the chat, but I was wondering if the $6,999 for transportation could be applied to monthly payments on like an adapted van, if a family had funded an adapted van.
Absolutely. So it's any maintenance. I mean, it could be oil changes, it could be tires, it could be the monthly payment, insurance. It's to cover any costs that come along with maintaining or purchasing a van.
And could that be used towards paying for public transportation as well?
Unfortunately, no. It's specific to acquiring and maintaining a van, or not a van, a accessible vehicle for that person specifically.
Okay. And then I was wondering whose responsibility is it to make sure that all of the other funding sources are explored first?
The agency that is developing the funding proposal, when they present it to the state, then we will ask those questions to ensure that they've explored all the options. The hope is that they are aware of all the potential other resources and have already done those steps. So again, it doesn't, you know, those answers are ready when the questions are asked, so it doesn't increase the stress or frustration of the folks trying to get services.
Yeah, I think that that's what I have been dealing with is the stress and frustration from the families that are going through an agency and the agency not necessarily knowing all of the other funding options and it really taking a long time. Yeah, I don't know. I guess it feels like it could be simplified in some way for for folks, like a universal application for benefits. Since the money's all coming from the state, it feels like. But anyways, I digress.
I don't disagree, and my assumption is it's because it's different funding sources, and also there's different eligibility criteria for each of the different programs. And I don't disagree that it's challenging right now because there's been such a high staff turnover, even at the state level, and folks that have been in their roles for decades and, you know, had contacts in different agencies and departments in the state. Those contacts aren't there anymore. So knowing where to find the information is challenging for people new in their roles, which is why, you know, webinars like this and you know, other discussions to get the information out there is I love doing, because the more information that's out there and the more people know kind of where to look or who to contact to get those pieces connected is helpful.
Yes, thank you so much for recognizing that. I was starting to feel pretty crazy that I've been doing this work for like 8 years and I'm like, wow, why is it so hard to find this information out? Like I'm really good at Googling. So thank you for running the webinar. It's been immensely helpful.
And I also want to acknowledge too, I mean, just the information we just talked about is just the intake process and initiating services. So there's other pieces, like you said, you know, and other information that that would be helpful. And it's a complicated system and there's lots of information. And if you don't know where to look or who to ask, you may not know of resources that are available or the possibilities with developmental services.
Yeah, and for me, that's kind of ironic because it's for folks that have developmental disabilities and intellectual disabilities, and it's like nothing is in plain language. And a lot of the times the families themselves probably have their own disabilities that they're dealing with, in addition to just trying to manage the care of their, you know, their child or whatever. So I think that that's been part of my struggle. I come from the world of accessibility. So, you know, I'm looking at trying to make forms accessible for folks and, you know, going to webinars that Green Mountain support services that are self-advocates that are putting on about plain language and wondering what are we going to catch up as a state entity with serving those folks? Because I can't wade through 100-page manual to figure out if my kid's going to be eligible for a service, you know, that sort of thing. But
And I'm glad you brought that up because the division is also attending those trainings or webinars about plain language documents. And we're creating a plain language document right now about appeals and grievances and the steps that, you know, make sure folks are aware of their rights, the process, you know, the timelines, just all the information about what it means to appeal or grieve something. And that is just the first document that we're working on. But again, I don't disagree that that would be a wonderful resource.
wonderful. Thanks so much.
I have a question, which you may or may not know any answer to or where it is at in the process. But during the pandemic, parents with home and community-based service waivers for their adult children have been eligible to apply for difficulty of care stipends. And of course, it's been at the discretion of the agency. And again, that's one of those things that's caused a lot of frustration for parents because some are very quick and upfront and other people are, I don't know, they don't get the information right away. But a lot of parents would like to see something like that continue, recognizing that it's very difficult to find care for their adult child and or trust the living situations for them to move out and be supervised somewhere else. So I'm just wondering if there's any hope for the future for families on that level.
So that possibility is being explored. There were town halls that the division hosted with family members, people in services, and also providers to get the feedback about, you know, exactly what you just said and people's experiences during the pandemic, what worked and what was great about it, what didn't work so great, and maybe something to be aware of, to explore if that's a possibility in Vermont. I don't have a definite answer for you today, but I know that it's being discussed.
Okay, thank you. And thanks for coming today. This was helpful. I just, as a follow-up real quick, this is back to the slides. When you mentioned funding priorities, it's really about the services of the person, not the agency's funding priorities. It's about what the person needs. Because I've heard that like term thrown around a lot over the years.
So the funding priorities are set by the division. So those are the criteria to be able to obtain those services. And the person is expected to meet that benchmark or criteria. It's not about the agencies. I mean, they're not setting those. They're required to follow them.
Gotcha.
There was another question in the chat. Are any people available to help a parent navigate all these complexities? And I'll just mention again that Vermont Family Network might be a really nice first stop for parents as they navigate all of these system complexities. And we can certainly help get parents connected with other organizations. Depending on where that parent lives in the state, there might be a more local organization that they could work with. So VFN might be a nice first stop. I'll open it back up to Melanie or anybody else on the chat if you have other suggestions as well.
So the agency the person is working with, that's part of their responsibility to help navigate. As I said, though, we know that there's a lot of new folks in their roles, and there may be information that they're not aware of. So I would point the person or their family in their direction. And if support can be provided by the division, maybe it's trainings like this or discussions, or if there's any barriers or unknowns, or, you know, it's not a clear cut about the person's eligibility or the supports that they meet criteria for, we can be a resource to help navigate that with the agency. One of the questions that was emailed earlier too was about services specific to folks with autism spectrum disorder. And I guess my answer would be not knowing, you know, I mean, one person with autism is different than another person with autism, that the same information that we talked about would still be followed. You know, it's about what their needs are with that, you know, with that disability, and what services would be helpful to them. So there isn't anything that is only available to folks that have are on the autism spectrum, or that is, you know, that's part of the criteria. It's about what their needs are and how that can be met.
Another question in the chat, did the criteria for developmental services change? My understanding was that the individual had to have an IQ of less than 70, but you mentioned the criteria of less than 75.
Right. So technically it is 70 or below, give or take 5 points. So 75 is easier to say. Prior to a decision by the Vermont Supreme Court, I believe it's 2019, I might have the year wrong, it was give or take 2 points, so 72 or below, that somebody appealed their eligibility decision, and it went to the Vermont Supreme Court, and it was decided that the criteria was should be changed to 75 or below. Well, 70, give or take 5 points or below.
Can I ask that question, just a follow-up question? So I have a student who's approaching 18 in that year of transition and has a cognitive score of 63, but then a GAI of 72. Is he likely to still qualify for services?
So we only look at the the full scale IQ. So it's 75 or below. We don't look at the GAI. If for some reason that is concerning in an assessment, then we really rely on the psychologist completing the assessment to, you know, if that for some reason the FSIQ or the GAI would be called into question because it doesn't make sense. They're the experts, and we rely on them to let us know if there's any concerns around eligibility because of that.
Another question in the chat, is there funding for assistive technology like smartphone technology or home modifications like ramps or bathroom accessibility?
So in the one-time funding allowable uses, those pieces are covered. I would though expect or hope that the, you know, assistive technology, I believe some may be covered through a private insurance or, you know, Medicaid program. So again, making sure that there aren't any other resources, you know, they're like within the community that would be available to help with those resources. But yes, those can be covered.
This is a good place to put a plug in for the Vermont Family Network Family Support Fund as well. So if other resources have been exhausted, including Medicaid, sometimes Medicaid will pay if it's for communication, then give me a call and we can chat. So we've helped with ramps and some assistive technology. It must be medically necessary. Yeah.
This was Tracy. That was my question. I meant smart home. I wrote smartphone, but I was thinking for folks that have physical disabilities, being able to like turn on the lights or open the doors or operate their TV remotely, you know, from their device, whatever. That sort of stuff is not medically necessary and is not covered by insurance. It could be covered by Choices for Care if they have Choices for Care, but the only $800 worth.
Well, we look at medically necessary based on a letter written by the physician. So each application is sort of looked at uniquely and individually. So I don't really do a blanket, like, yes, this is covered, yes, that's not covered. Home modifications typically are excluded from our fund. And actually, now that I'm talking, I don't know, maybe that was directed towards Melanie for the waiver.
So one-time funding could also be used if it, because one of the categories was home accessibility. So again, depending on the person, depending on what technologies is being looked at, it could be covered potentially depending on the details.
Great. Well, thank you so much, Melanie. I don't see any other questions in the chat. You have covered a ton of information today, and we certainly appreciate your time. I have personally found this information extremely helpful. So everyone should be seeing in the chat a link to an evaluation. If you could please just take a few minutes to complete it so we can make improvements and fulfill our grant requirements, we would really appreciate that. We do have more interesting workshops coming up, and you can find details about those on the homepage of our website, vermontfamilynetwork.org, along with the links to the previously recorded ones. We have tons of information on our website, and getting connected with us is easy. You can follow us on Facebook or join our closed Facebook page if you are a parent. We have 2 closed groups, one for all parents of children with disabilities and special health needs, and one for those with adult children. You can also sign up for our monthly e-news or check out our YouTube channel. We are here to help. Please contact us by phone or email. And thanks again, everyone. Thank you, Melanie, and have a great day.
Thank you, everybody, for coming and asking your amazing questions. I really appreciate it.